Welcome again to the news edition of today. I am honored to have a guest who is an expert in global health. You can introduce yourself.
Thank you. My name is Nsengimana Jean-Pierre. I'm a student at Southern New Hampshire University in the Faculty of Healthcare Management and Concentration with the Global Perspective. Thank you.
Okay, thank you. I will start with asking you some questions which I have prepared here. Global health seems to be in the news more and more in recent years. I think you would agree. Talk about what global health is and why it is important to pay attention to it.
Thank you so much. Global health is an area of research, studies and practice that places priority on the development of health and the health equity for the people in the world. It is very important because it is concerned the good living of all of people living in the world. Every people in the world is concerned in global health. Thank you.
Thank you, Jean-Pierre. Another question: disease can come to us in different ways. Explain the difference between communicable and non-communicable disease.
Thank you so much. I will start with non-communicable disease. Non-communicable disease are those diseases that are not transformed from one person to another, while the communicable diseases are the diseases that can be transformed, that can be taken from one person to another. One person can transform the disease to other one. That is the communicable disease.
Can you give us some examples?
Some example for non-communicable disease, there are cancers, there are diabetes, and the cardiovascular disease. While in communicable disease, there are HIV, hepatitis. There are so many communicable diseases.
Okay, thank you. Now let's talk about Ebola. Since I'm sure of our viewers have heard a lot about that, what is it? What is Ebola? And is it a communicable or non-communicable? How do people get it?
Ebola is a virus that causes severe bleeding and can even kill the people. Ebola is a communicable disease because when you are with someone who is affected by Ebola, by touching him or her, you can be affected by Ebola. Thank you.
Thank you. Now, what would raise a person risk, or what are the risk factors of getting Ebola?
Thank you. As I have said, having contact with someone who is affected to Ebola can cause someone cause someone to be affected by Ebola. Yeah, thank you.
Okay, so to prevent, or at least to lessen or to reduce the chances of getting Ebola, what should people do?
Thank you. There are many things to do to prevent this virus spread from people to another, such as when you know that the press is suffering from Ebola, you have to be careful. First of all, you have to avoid contact with the different people, especially those who are affected by Ebola. Also, you have to wash your hands with clean water and soap. Also, in an area where there is a pandemic, um, those people who are affected should be in isolation. Thank you.
Okay, thank you. Another question. Outbreaks such as the one related to Ebola can generate a lot of rumors and misinformation. Even panic can occur. So, how it is transmitted and how likely people are to get it. In other words, talk about the needs for educating people about facts versus myths. How people can actually differentiate the true facts related to the disease and the myth or the misinformation.
Well, first of all, people should be educated about Ebola, such as knowing what is Ebola, such as knowing the sign of Ebola, and how it can be transmitted from one person to another. This will help to overcome the myths of people about Ebola, and teaching them how to practice when you are in the area that is suffering from Ebola. Thank you.
Okay, now the next question. How about the complication that Ebola places for rights of travelers and the responsibilities of governments? Kachi Hickox, for example, a nurse from Maine who returned to the States following a trip to West Africa in the fall of 2014, promptly had quarantine-related restrictions thrust upon her, restrictions that she was very much against. Briefly, describe the difficulty of balancing individuals' rights and the government responsibility in order to curb the effects of pandemic.
Yeah, thank you. As we have started by talking about global health, when we are talking about global health, we are talking about the lives of all people in the world. So when there is a pandemic, we have to know that we have to help people to be healthy, those who are not affected. That is why governments impose the way of preventing the pandemic spreading from one people to many peoples. That is why some people can understand that we are trying to keep we are trying to avoid the spreading of the pandemic. So that is why the governments used to put people in quarantines, isolation, so that there cannot be the spread of pandemic in all people living on the places. Thank you.
Okay, thank you. Now the next question now. Let's talk about smoking and tobacco use, which is considered a big world health problem and raises similar issues to Ebola in terms of rights and responsibilities. Just about everyone knows that smoking harms health. What does it to the body? What do smoking do to the body?
Well, everybody knows that tobacco, cigarette, and smoking is very harmful to people's body. We know that when you are smoking tobacco or other related stuffs, such as smoking, we know that the smokes can go into the lungs, and then they start to damage the lungs, which can even cause cancer and the other respiratory illnesses. Also, smokes can even damage the blood vessels of the people. Many people doesn't know that smoking can even lead to the heart attack disease when the blood vessels are distracted. That is why tobacco or smoking cigarette is very harmful to the people's lives. Thank you.
Okay, thank you. Now the next question: what about second-hand smoke? Explain what is second-hand smoke and how it affects people.
Thank you